By the end of this module, you will describe multiple causes and risk factors of mental illness, differentiate between predisposing, precipitating, and protective factors, recognize how environment, trauma, and culture affect mental health, apply the biopsychosocial model to real-world scenarios, evaluate dual diagnosis and the role of substance use in mental health. Mental illness does not arise in a vacuum. It is the result of complex interactions among biological, psychological, environmental, and social influences. This module aims to provide you with an in-depth, research-backed, and multi-dimensional exploration of these factors. You will also understand predisposing, precipitating, perpetuating, and protective factors, a framework that is vital in mental health first aid and clinical contexts. This module is crafted to meet professional training and accreditation standards by including evidence-based frameworks, case studies, holistic and trauma-informed analysis, culturally competent explanations. Biological and genetic factors. AA. Genetic vulnerability. Family history plays a strong role in many mental disorders. For instance, schizophrenia has a 10% risk if one parent is affected, rising to 40 to 50% if both are. Genes don't guarantee illness but may increase susceptibility. B. Brain chemistry and structure. Imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine influence mood, thought, and behavior. Brain scans reveal abnormalities in brain regions like the amygdala, hippocampus, and prefrontal cortex in individuals with depression, anxiety, and PTSD. C. Hormonal changes. Thyroid issues, adrenal dysfunction, and postpartum hormone shifts can trigger mental health symptoms. Women are more prone to mood disorders due to hormonal fluctuations. Psychological factors. A. Trauma and abuse. Childhood abuse, neglect, or witnessing violence can deeply affect brain development and self-concept. These adverse childhood experiences, ACEs, increase the likelihood of depression, PTSD, and addiction. B. Personality traits. Traits such as low self-esteem, perfectionism, or high neuroticism may increase risk. Personality disorders often co-occur with mood or anxiety disorders. C. Learned behaviors and cognitive patterns. Negative thinking, catastrophizing, and distorted beliefs can lead to chronic stress and mood disorders. CBT, cognitive behavioral therapy, targets these thought patterns effectively. Environmental and social factors. A. Social isolation or loneliness. Lack of meaningful connections is a major risk factor for depression, especially among the elderly and youth. B. Work and academic pressure. High performance demands, bullying, job insecurity, and toxic work environments contribute to stress-related mental health issues. Socioeconomic factors. Poverty, lack of access to health care, housing insecurity, and unemployment increase vulnerability. Economic instability can lead to chronic anxiety and demoralization. Cultural and community influences. Stigma and discrimination in some communities may discourage people from seeking help. Language barriers and cultural misunderstandings also contribute to delayed intervention. Substance use and mental health. Dual diagnosis. Substance abuse can both trigger and worsen mental disorders. Individuals may use drugs and alcohol to cope with untreated mental illness, self-medication. Dual diagnosis requires integrated treatment for both conditions. Stress as a catalyst. Acute stressors, loss of job, breakup, illness, and chronic stress, financial hardship, toxic relationships, are known precipitants of mental illness. Stress impacts the hypothalamic pituitary adrenal HPA axis and increases cortisol levels, disrupting mood regulation. Protective and resilience factors. Understanding what protects people from mental illness is as important as knowing what causes it. Strong social support, access to education and health care, coping skills and emotional regulation, physical activity, and healthy diet, spirituality or a strong belief system, stable housing, and employment. These factors form the foundation of mental resilience, which can prevent or buffer against the impact of stressors. Biopsychosocial spiritual model. This model integrates all causes and sees mental health as a dynamic outcome of interplay among biological, psychological, social, and spiritual domains. It is widely accepted in clinical psychology, psychiatry, and MHFA programs, and is key to whole person care.